My name is Denise Stite. I am currently the president of the Missouri Association of Nurse Anesthetists, and we represent 1,700 CRNAs in the state.
We're the experts in anesthesia as the CRNA. We understand how to give medications, how they work, what they need to do, how they get out of the body, and how to take care of the patients in that perioperative setting.
A CRNA on a day-to-day basis puts people to sleep for surgery. It could be simple surgeries like colonoscopy where we provide moderate to deep sedation, or it can be complex surgeries such as major belly surgeries or knee surgery that requires general anesthesia.
All we want is for the Missouri laws to more closely match how reality is, how practice is.
Supervision in Missouri law is a requirement for the podiatrist, the dentist, or the surgeon or physician to sign off on anesthesia care. This podiatrist, physician, surgeons aren't the ones providing the anesthesia. The CRNAs are providing the anesthesia.
It does not make sense for someone who is highly educated and trained in a field to have to get permission to do what they're licensed to do from someone who has less experience in that particular area.
As a physician, I don't feel that surgeons, podiatrists, or dentists should be overseeing the delivery of anesthesia.
It is very important for Missouri state statutes to be changed because they're 20 years old, they're antiquated, and they need to be updated with all the other states that are around us to provide the freedom for CRNAs to practice independently.
CRNAs from around the United States aren't going to want to come back and practice in the rural communities in Missouri because there's 43 other states that are willing to let them practice to the full extent of their scope.
There are either hospitals closing or hospitals that are limited on the amount of services that they provide because of the lack of CRNAs and surgeons that are going to that community.
Having a community access hospital nearby me allows me to get the care I need. I don't want my hospital to close.
Missouri is down to 35 critical access hospitals, and that is meant to serve the 2 million rural Missourians. This in comparison to Iowa, which has 82 critical access hospitals, or Illinois, who has 51 critical access hospitals, and each of those states have a less rural population than Missouri. Rural Missourians are struggle to find surgical services and anesthesia care because of their limited access.
If you're the legislator and you're on vacation and you're traveling through Lebanon, if you don't have a CRNA there to take care of your anesthesia after you've been in a car wreck, you're going to die because they're the people that provide that care in our area.
We're asking just to bring all of our rules and regulations up to current standards so that we can practice and take care of our patients.
So I would say if you're a patient, you're really going to benefit from having increased access and more providers in your state.
I'm asking you to support this legislation because CRNAs have the knowledge base, the skill set, the compassion to be able to deliver anesthesia without oversight from physicians.
We want to urge legislators to support these bills because we're asking for unified anesthesia care across the state, no matter where you live.